Oh, what the hell was that? Ultimate burn trauma, extreme limb damage, and supernatural forces with no hospital in sight. Today, we're breaking down and reacting to the wildest medical scenes from Stranger Things. Let's dive right into the Upside Down. Wow, take a look at this face. Okay, yes, I know it's a creature, but just looking at the nose itself.
Your nose!
A nose looks like this when you've actually lost all the tissue and the cartilage of the normal part of the nose, because the rest of it is actually made up of bone. You do see this in sometimes traumatic injuries or people who have had cancer, skin cancers commonly in this area. You can have some septal defects, you can have necrosis. Oh my gosh, some levitation going on.
Levitation, Holmes!
Sometimes I think patients at the hospital feel this way, that they're on like another planet, they're floating. When people get morphine or Dilaudid or any opiate, they actually have a sensation of floating and feeling very light. Oh, what the hell was that?
What the hell is even that?
Massive claw into the face, and anatomically it's still realistic. We're having the PIP joint, the DIP, the normal way the hand would appear, just on a larger scale. Massive fractures, dislocations. I have seen people come to the emergency department with MAC 2, sometimes 3 dislocations of different joints. Usually it's one big joint that takes most of the hit. Elbow, a knee, a hip. Sometimes we even see as simple as like finger dislocations or even toe dislocations. First injury is like a bite wound decapitation. In emergency departments, we don't deal with bite wounds like this, but we do deal with rattlesnake bite wounds that I see in Southern California, domestic animals and stray animals. Always really good to take photos if you can, so that way we can identify what got you. Oh, nasty puncture wound, as well as traumatic like injury to the abdomen. People do get traumatic blunt injuries. Most of these are car accidents that we end up seeing for blunt traumas, or people getting hit by a car. Remember, airway, breathing, circulation, disability, and exposure. That's what we're looking for in the primary assessment. Oh my gosh.
Oh my goodness.
If somebody had a traumatic injury that their face actually ended up looking like this, you're going to want to manage the airway. You can easily put an endotracheal tube in a patient with massive facial trauma. Oh, to the dome. Taking an impaled object to the head, right? Into the airway, mouth. We know that that would not be compatible with life for a human.
I'm a human!
But could you survive for a short period of time? Depends. If it's just getting your airway is going to get compromised, and then that's going to have you succumb to your injury. Nice. These creatures are just getting destroyed by the flames. Issues of scar formation pretty fast where the tissue is melted. Individuals' chest walls are so rigid because of the scarring immediately that you have to do an escarotomy, basically where you're cutting the tissue and allowing the tissue to expand. Well, we learned that they don't like fire. Fire also takes away the oxygen around an individual. You will potentially breathe in the flames, which can melt your airway, which then will occlude your airway, or have delayed swelling, which again increase the risk of blocking your airway. Oh, cool. Arm gone right at the humerus. The humerus is now being cut right down the middle, so you're cutting through the bone, and you're bleeding horribly through the brachial artery that is sitting right there. That's the artery that you would feel in a baby, young child for their pulse. A lot of blood. Maybe right there we're seeing like the spine, the bones. We definitely know that there is a spinal cord and the vertebrae because of the previous back views that we've seen where all the ribs are attaching. And we see the spinous processes, those little nubs on the back. Smoking, not good for you, right? No benefit of smoking. Definitely increases the risk of cancer, shortens your life. So please do not smoke. Taking a sledgehammer to the ankle, trying to break off this cuff. You're definitely getting destroyed at the ankle. Ouch. Big amounts of swelling, bruising to this area, and significant amount of pain. Strangulation, two things that we worry about. Airway compromise, you can break the hyoid bone, you can affect the trachea. Then you have vascular compromise, so you have those big major vessels on either side of the neck. You have carotid artery and the jugular vein. Oof. Oof. So interesting, the abrasions that they have to their face. A lot of times when somebody gets punched in the face, you're seeing bruising or a laceration. You don't see these abrasions as much unless you're scraping on the ground or you have rings on your hand that's scraping across the face. Oh. Oh, man.
Oh, man.
This is how some people feel when they come in when they have their patella dislocated. When it comes to big dislocations like this, you worry about vascular compromise. All the blood vessels that run behind the knee. We'll put it back in and then we have to make sure the vasculature is intact again, most likely with a CT angiogram. Those eyes are all white. The white part of your eye is called the sclera. You have your iris and the pupil. When people get older, you can get cataract, which clouds the lens, deciphering between the anterior and the posterior chamber of the eye. Oh, good catch. If watching them fight all these interdimensional beings has your stress levels climbing, that's where Chillax from my company, Life Happens, could come into play. Designed to help you stay calm when life goes sideways or upside down. Find Chillax at lifehappens.com or on Amazon. We do get worried about bats and rabies. I don't think your local primary care doctor's office has that type of vaccination, so it's okay to come to the emergency department for that. Maybe give the emergency department a call before you head there to make sure that they actually do have it. Oh no. Eddie must have had catastrophic blood loss to cause him to have lost his life. Usually if you lose 40% of your blood volume and pass away, you're going to be altered, confused, cold, probably not going to be awake. It would probably be more of he's going to be unconscious but still alive and then slowly fade away. Stranger Things. If you guys love Stranger Things, let me know in the comments if you want me to do more videos talking about Stranger Things and reacting to it. And do me a favor, check out this playlist right here, binge watch everything. And as always, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.